Any idea what is the problem with hypertension? One of the problems? End organ damage, that is end organ. Okay, before that, much before that, what is the possible problem with hypertension? Stroke होते हुए ठीक है, शेष दिखे आगे की है. The first thing is hypertension is what we call the iceberg phenomenon. Okay, and in which majority of the cases are undetected. क्यों जा रहे हैं ना blood pressure से? ताई जन्ने if you go for a camp, sir हमारा pressure देखो, pressure देख लो, pressure बेड़े से, औषध लिख लो, औषध खावे ना. Second question, क्या खावे ना? Why won't you take the medicine? Why won't you take the medicine for given for blood pressure? बोलो. Why won't you take the medicine given for blood pressure? It takes medicine for other things. The pressure औषध खावे ना. Why? The reason is that he says, "Shara जीवन खेते होगे कि ना?" So ताई जन्ने he will not take. So he will not ask this question about the things. He's got dengue औषध खावे और अन्य किसी होगे, but এটা জিনিস হচ্ছে সারা জীবন খেতে হবে, তাই জন্য he will not take it. That is the second problem. That's why hypertension goes unnoticed, uncared and undetected. Okay. So what is the target organs which occur here? This is angina, you can have left ventricular hypertrophy, heart failure, brain, chronic kidney disease, peripheral artery disease, retinopathy. Sudden onset of blindness. You please check the eyes. There may be retinopathy, there may be hemorrhage. Okay. So this is somebody said end organ damage. Here, these are the organs which are there. Benefits of lowering BP. Obviously, you reduce the incidence of heart attacks, you reduce the incidence of stroke, you reduce the incidence of heart failure. 30 to 40% reduced if the BP is decreased. Okay. So you have two types. You've studied in physiology, I think. Primary and secondary. Secondary is due to other diseases. Primary is due to your initial cause only. Okay. So secondary we have chronic pyelonephritis, tumors of adrenal glands, congenital aortic stenosis, toxemia of pregnancy in gynae. All these are secondary causes, but the primary causes still the primary causes are major causes. So BP rises with age. As the age increases, BP rises. Obviously, you will be having less BP than me. Second thing is, men show higher during adolescence, but later life women show greater BP because of the hormone factor probably. Genetic factors, again, there's strong correlation between twins, and blacks and Africans have higher BP levels than whites. So this is a study showing the age group in which BP increases. So we have one of the highest age groups is 60 to 69. They are the highest. Very few BP below that. Okay. So again, same study, untreated hypertension. Now, risk factors. So this is the risk factors for hypertension. One is obesity. Can you modify obesity? Can you modify obesity? Bolo? Yes. How? Huh? Exercise and diet. Very good. That is modifiable. Second one is salt intake. More than 5 grams per day. So Japanese take more than 7 grams, and that's why they have a greater incidence of hypertension. Okay. Third is saturated fats. They increase the cholesterol, again leading to high BP. Fourth one is dietary fibers. People don't take dietary fibers. In many places they don't take dietary fibers. Lucky we have a climate where we take dietary fibers like saag, palak, etc. And that reduces the cholesterol and etc. Okay. Then again, alcohol intake, environmental stress, anxiety. Kal ke result bero check hi korbo. Stress, okay. Stress hoy? Na hoy na. Auto hoy na. Kokon auto hobe? Final mi shobe naki. Jani na. Acha, okay. Ekhono hoy na. Environmental stress and heart rate. Physical activity again promotes positive health, reduces the BP. Socioeconomic status. Aage bolte those who have high blood pressure belong to the very affluent families. A lot of jyada peshi paisa ache, their BP. It's not the case. It can happen to anybody now. And so that is the thing. Low socioeconomic status also high BP. And others like drugs, noise, vibration, temperature, humidity, all this cause BP. Now, this is important. Metabolic syndrome. This is a combination of high BP, dyslipidemia and obesity. So here, If men have a waist circumference of more than 40 inch, women have more than 35 and triglycerides over 150, then it's called, there can be a risk of metabolic syndrome, okay. And fasting glucose should be more than 110. About blood pressure measurements, কি করে নেবে blood pressure? Let me ask you, how do you take the blood pressure? How do you take the blood pressure? Suppose I have come for taking my blood pressure, কি করবে? You are a doctor, I have come to your room, clinic, take your blood pressure. By sphygmometer, okay, how will you do it? Now, how will you do it means, will you take any precautions? Will you take anything? I am coming straight from, where's your house? Where's your house? Huh? Kolkata kothay? Sonarpur. I am coming straight from Sonarpur station to your clinic. I am come by train. You are going to take my BP. So is there anything else you will do? Relax kore bosha. Exactly. Relax kore bosha. That is called white coat hypertension. Okay. So that is one thing. Observer error is there. Instrumental errors. Leaking walls, inappropriate cuff size. Suppose you get somebody who is slightly very fat. Your cuff will not work, or a small child. That cuff will not work. So you need a baby cuff for a pediatric case and a big cuff for somebody who is very obese. And subject errors. Circumstances examination, physical after exertion, mental status, fear, anxiety, etc. Suppose a patient is waiting a biopsy report. He's gone to a clinic and he's waiting for a report. He's seeing the biopsy. His pressure is shooting up. Okay. So this is what they say. Measure over both left and right arm at first visit. 3 times over a period of 3 minutes. Onek shomoy BP ekbar korlo, the BP is not correct. Repeat it over 3 minutes. Record the lowest BP, specifying the arm. Like example, 140 by 84, left arm and sitting position. Now this is something, okay. You mentioned about BP. What is systolic blood pressure? What is systolic blood pressure? Huh? What is systolic blood pressure? How do you say it's systolic? How do you say it's systolic blood pressure? How do you say something is systolic blood pressure? What is systolic? What is diastolic? I'm asking a physiological question. Physiological question. Huh? Systolic is contraction. So diastolic is? Okay. How will you, when you in the BP, when you're measuring BP, কি করে বুঝবে? Higher value কি করে বুঝবে? Higher value কি করে? Higher value কোনটা কি করে বুঝবে? সেটা বলবে। Huh? What's the? Sound টা শুরু করে। Okay, that's the start of sound is systolic. And diastolic টা? Stop. Previously during our time there was a debate over diastolic BP is muffling of sounds. Because muffling is a vague word. Muffling means lakche na. So it's very vague. Now there's disappearance, complete disappearance. Okay, that's what this what I tried to do. And follow up at least 3 visits required for final classification. So this is a normal BP is systolic is below 120, diastolic 80. Then you have 2 stages, pre-hypertension and you have 140 to 150, 90. Stage 2 hypertension, stage 3 is more than 180 systolic. That is the dangerous one, often called malignant hypertension, which can cause stroke also. Okay. So how do you control hypertension? Nutrition is one, less salt, moderate appropriate calories, no alcohol, adequate fibers, weight reduction, physical exercise, behavioral changes like no smoking, reduction of stress, yoga, transcendental meditation, and health education, self-care. This is the population. For the general population, you can give them a koro. Many of them might accept. I can not accept. Lifestyle modification, again, same thing. Lose weight if it's overweight. How do you lose weight? How do you lose weight? Then the calorie table, practical table or app there, weight. Tell me, how do you lose weight? Exercise. What exercise? What exercise?
High intensity interval training.
Wow, high intensity. Simple exercise. What exercise will you do? Cardio. Wow. Huh? What? Strength training. Wow, I should have shouldn't. Simple thing. Something very pati jinish. Running is one. Walking for half an hour. Cycling. Huh? These are simple things. Swimming. These things. Those are all. Modify cardio. What is the train training, whatever it is. Simple things. So take a long walk, go for go cycling, go for swimming if you can. Okay. And overall cardiovascular health, maintain adequate intake of calcium, magnesium, stop smoking, reduce dietary saturated fat and cholesterol. So lifestyle modification, you reduce the weight, adopt DASH diet. What is DASH diet? DASH means dietary approach to stop hypertension. Okay. So DASH doesn't mean running, but DASH means dietary approach to stop hypertension. This came as a university question, I think this batch. Physical activity reduces BP by 4 to 9, DASH diet by 8 to 14, and weight reduction reduces your BP by 5 to 20 milligram. So this is DASH thing. Diet high in fruits and vegetables and low dairy products. Okay, like for example grain products, vegetable fruits, etc. So high in fruits and vegetables, not in chicken, fish, etc. It should also contain grain. So 4 to 5 vegetables, 4 to 5 fruits, 2 or less meat, poultry and fish, 2 or 3 low or non-fat dietary products. This is called DASH diet. Then high risk strategy. That was general strategy. This is a high risk strategy. You know that this person he's a high risk patient for hypertension. Why? His father's got blood pressure, his grandfather had died of blood pressure. So he's at a high risk. So tracking, and he's also got some of the risk factors. So subject to any of the risk factors, and tracking of BP in a subject with familial hypertension. Somebody who's got hypertension in the family, you just check him to see whether he's developing hypertension. Now, what are the consequences? Stroke, congestive heart failure, kidney disease, heart attack. Prevention control, how do you prevent it? Screening. You can screen the general population. In any place you go, medical camp poste, so doctor over pressure to the They check their pressure, but nobody notes it. Very rarely do they take their medicines after that, because the question is, Sara Jeevan khete hoye. That's why they don't take it. Okay. So every individual should go at least once a year for checkup. Every European who goes once in 2 years. They say mass screening is fruitless. Shavai BP check correlate is bekar. And camps, yes. Okay. Then evaluate people with hypertension, assess lifestyle, reveal identifiable gaps for high BP, and assess the presence or absence of target organ. For example, if a person has BP, ideally you should write a ECG to find out whether is something wrong in the ECG. ECG beshi lage na. Maybe if he's got more time, you can do an echocardiogram or a renal function test or something. But at least ECGs should be done. But majority of places, we just write pressure BP 180 by 100 plus khalashesh. No ophthalmic consultation, no ECG, nothing is done. So that ideally should be done. These are tests which are routinely to be done. ECG, urine analysis, glucose, potassium, creatinine, lipid profile. An optional test is urine albumin. And this is more or less what is there in everything. And treatment for hypertension to reduce it to 140 by 90. Assess the presence of any target organ damage. So classes of antihypertensive drugs you have learned in your, or you're going to learn in your pharmacology. I'm not going to details of this. These are medicines which are coming up. So this is this is a lifestyle modification, then the various things. Stage 1 you start with thiazides, stage 2 drug combination, stage 3 you add more drugs, etc. So hypertension iceberg phenomenon. Now this is important. What is and rule of halves? Half of the people in 50% of hyper people are aware of the problem. Okay. Only 50% of the people are aware of the problem who have hypertension. That means if there are 1,000 people who have hypertension, how many are aware of the problem? If there are 1,000 people who have hypertension in a population of 5,000, but a population of 10,000. In a population of 10,000, there are 1,000 people who have hypertension. Now look at the board and tell me, how many of them are aware of hypertension? 10,000 people in a population, 1,000 of them have hypertension. How many of them are aware of that they have hypertension? Huh? 500. Only 500 aware that they have hypertension. Again, only 50% of the aware patients take medicine. That is 50% of 500. 250 people only take medicines. And again, out of those medicines, 250, another 50% only take the medicine the real proper way. That means only 125. That means out of 1000 patients, 1000 people with hypertension, only 125 are really taking medicines the way it is prescribed. That is why it is called a rule of halves. Doesn't mean that half the population of the world is hypertensive. Okay, it does not mean that half the population, both of us, one of us will be hypertensive, among those who are hypertensive, 50% do not know that they have hypertension. 50% are of those who are only aware and they take the medicine, and even less than 50% take full medicine. So that is why it's called the Iceberg Phenomenon rule of halves. So hypertension, say this is an example which I told you. 1,20,000 may be suffering from hypertension. It is bhalo kore dekhe na. If you will get, jara aage shuni bas dekho ne. Take a look here. Out of population of 1,20,000 will be suffering, maybe suffering from hypertension. Out of that, only half will be knowing. That is 10,000 will be knowing they have hypertension. Only 5,000 will be seeking treatment, and only 5,000 out of that, only 2,500 will be seeking full treatment. Rule of halves does not mean that half the population is hypertension. Eta mone rakho. Rule of halves does not mean that half the population is hypertension. Is it clear? Rule of halves does not mean that half the population is hypertension. Recent examiner, sir, half the population has got hypertension. No, it doesn't mean that half the population. This is different. Then in secondary, the thing is, patient should be motivated for drug adherence. That's the most important. Drug compliance. Sara jivan khete hobe kina. That is the thing. That is my khabana. And also the diet and other things. So guidelines for improving adherence. Aware of signs of non-adherence. So should ঠিক মতো খাচ্ছ তো? না আমি খাচ্ছি না, আমি বিয়ে বাড়ি গেছিলাম, এখানে গেছিলাম, ওখানে ভুলে গেছি, খেতে পাইনি। Then encourage a positive attitude about achieving goals, maintain contact with patients, keep care inexpensive, simple. So these are the other guidelines for therapy, adherence therapy, adjust therapy to minimize adverse effects, prescribe long-acting drugs, etc. And low dose of initial drug, then increase it. These are the various combinations. We don't go into that. Follow up. So obesity. We all know that obesity, what is obesity? We don't know what is obesity, but we know that somebody is obese and he's fat and all. And health consequences of obesity. Now obesity has got a direct link with diabetes, cardiovascular disease as well as hypertension and diabetes. It also has a connection with cancer, mental illness. And so here what happens, excessive fat accumulates, okay, in various parts of the body, and leads to negative effect on health, leads to reduced life expectancy. So how do you measure obesity? For measurement of obesity, you take the BMI. What is BMI? What is body mass index? Now, what is the formula for body mass index? Bolo. Weight by, okay. So that is, so first thing that we will see is look at the body mass index. If the body mass index is more than 30, it's a measurement, it's a thing for that is obesity. Second is waist circumference. Waist circumference should be more than 90 centimeter in male and 80 centimeter in female. That again is obese. Similarly, waist hip ratio 0.9 in males and 0.85 in females. These are all measurements of obesity. Okay. The commonest one we take routinely is BMI, waist, hip and all this is there, but it's a bit complicated. Okay. But here for children, what do? Children, you don't take BMI, you take children less than 5 years, weight to height, more than 3 standard deviations. You've had a class on, those of you who had the posting, you know what it is. 5 to 19 years, you look at the WHO standards. If it is more than 2 standard deviations, it is considered as, if the BMI is more than 2 standard deviations, it's considered as obesity. Okay. So you have 2 types of obesity. One is apple shape and one is pear-like shape. The apple shape is the one which people refer to as abdominal fat, more common in men, pot-bellied, Fat is stored around the organs, like increases risk of disease like diabetes, hyper. Second one is lower body fat. It's common in women. Fat around the hips, buttocks and thighs. Less risky, but leads to orthopedic problems. Okay. So you have a body shape like an apple shape and a pear shape. So the prevalence is much higher in women. That's what the Bangladesh study says. And 1.9 billion people are considered as obese who are aged 18 years and above. So what are the reasons for obesity? Behavioral and lifestyle changes. Can you give some example of behavioral and lifestyle changes? Bola? Behavioral and lifestyle changes which can cause obesity. What could be a possible reason? Sedentary lifestyle. Okay, what else? Huh? Stop eating junk food. Yes, then? Overnutrition. So overnutrition, eating junk food, then you said lack of exercise. All these are the things. Okay. More screen time. Then, okay. So again, obesity is caused by diseases also. Can you name some disease which cause obesity? Diabetes, mellitus, something else which causes obesity? PCOD, okay, PCOD. The PCOD not exist, it doesn't cause that much. RK. Some syndrome, which patient looks fat. Huh? Not thyroid, the thyroid. Cushing syndrome is one, okay. And hypothyroidism is another. And so these are the various factors. Then unhealthy dietary patterns, we just spoke about that. Less physical activity, medication use, fast food, unfavorable physical environment. What do you mean by unfavorable physical environment? Unfavorable physical environment key. Huh? What is unfavorable physical environment? There is no park, you are staying in a flat, khala jaga nahi, kichu nahi. So mart nahi, something like that. Okay. Then less education skills, food marketing and promotion. This is very important. You'll always find during the middle of a match, TV program or something interesting program, you suddenly find an advertisement for a food promotion. Maybe Maggie, maybe something else, maybe some food. It's all meant for this thing. Food marketing and promotion. Corona lockdown is another factor in which there was a lot of changes. And smartphone use. Okay. So many diseases like Cushing syndrome, polycystic ovary disease, thyroid, drugs like steroids, antidepressants, and mental illness like depression and eating disorders. Can you name some eating disorder which you have learned in physiology? Bulimia and anorexia nervosa. Anorexia nervosa is basically a disease in which people try to become slim, particularly the ladies, the girls, they want to stay slim forever. And bulimia is binge eating. So you have anorexia and bulimia. Okay. Then these are the diseases which obesity causes, like hypertension, dyslipidemia, type 2 diabetes, stroke, coronary heart disease. Also causes gallbladder disease, osteoarthritis, sleep apnea, and obesity related asthma, endometrial breast, colon cancer, low quality of life, and mental stress, and also chronic pain. So this is diabetes and obesity have a complex, both are very interlinked. Obesity stands as a risk factor, diabetes also is a risk factor of obesity, and it causes insulin resistance. So here are the things, it causes impaired glucose tolerance, beta cell failure, and causes type 2 diabetes. So obesity indirectly causes type 2 diabetes. So people with central obesity are more at risk of developing diabetes mellitus and coronary vascular disease. So if the BMI is not increased, the risk would be less. Okay. So again, these are various studies we have done. Waist to hip ratio again, if there was reduced, it would have been better. These are different studies. So what are the things which happen basically? Activation of the sympathetic nervous system, activation of the renin-angiotensin action, and sodium retention. So this again leads to increased dyslipidemia, hypertension, myocardial infarction. So these are the common things which is called obstructive sleep apnea. obesity hyperventilation syndrome, COPD, obesity related asthma. So here is the respiratory disease, the chart. Okay. What are the problems with obesity when the physical problem with obesity and lung and respiratory disorders? Bola. What is the respiratory disorders and obesity? What is the physical problem? Bola. কেন ডিসপ্লে হতে পারে কেন হবে সিম্পল ভেরি সিম্পল ওয়েট বেশি হ্যাঁ ডেফিনেটলি ওয়েট তো বেশি তাই জন্য ও ঘুমোতে পারছে না ঠিক মতো ঠিক আছে সো ই হ্যাজ টু আইদার এইদিক ওইদিক করতে হবে সিমিলারলি তোমরা যারা ট্রেনে মোস্ট অফ ইউ ট্রাভেল বাই ট্রেন ট্রেনে যারা বাড়ি যাচ্ছ বা কোনো জায়গায় অলওয়েজ দেখবে লোয়ার বার্থে অলওয়েজ সামবডি হুজ ফ্যাট প্রফেসর লোয়ার ও উঠতে পারছে না ওকে শুতে পারছে না. So it's really difficult. We're not ridiculing them, but the point is sometimes it's not possible. Okay. So that's why the respiratory problems and overweight is there. COPD is there. These are the different studies. And they're saying in Australia, post-menopausal women also have hypertension, which is there all over India, or all over the world, not just this. And women with higher BMI are having risk of breast cancer. Obesity and mental illness are also linked. Obesity, if somebody is obese, he's under some psychological pressure. বাড়িতে বলছে লোকজন বলছে ওকে ডাক নাম দিয়েছে মোটা কিছু একটা ইয়ে করে দিয়েছে when he goes to work তখনও এরকম হচ্ছে and then he becomes depressed. So poor body image, binge eating, antipsychotic medications, all this can cause a lot of problem. Okay. So again, depression is one of the major problems. These are all various studies. যাচ্ছি না. So for adults, what are the barriers? Some people may not change their lifestyle. আমি মোটা আছি বেশ করেছি ঠিক আছে but some people you tell them to have this food, not to have junk food. না আমি খাবো না আমি এটা ভালো লাগে I like Maggie, I like this, I like that. আমি মোমো খাবো আমি এই খাবো চাউমিন খাবো all that stuff. Okay. And cost of availability of health foods. Previously when we were small, eating outside was a bit difficult in the sense that there were not many stalls. We had to go to a big restaurant to have food and it was not always possible. Now you have everywhere you're selling roadside food, fairly accessible to everybody and low cost. But the problem with that is these things are also increasing. Okay. Safety concerns, for example about cycling. Ke bollo cycle, I only told you about cycling. Cycle chalabo ki kore? Cycle challe amake dhakka marbe, ami pore jabo. So no exercise. Then lack of time, personal taste, views of family and community members. বাড়ির লোক বলবে না তুমি খেলাধুলা করো না পড়াশোনা করো প্লাস low levels of fitness, low self-esteem, lack of assertiveness. Okay, these are the real problems for children and young adults. Availability of junk food in their schools, lack of time, lack of confidence, lack of self-esteem. Lack of time কেন সকালে টিউশনে যাচ্ছে বিকেলে টিউশনে যাচ্ছে বিকেলে ডান্স ক্লাসে যাচ্ছে কারাটে ক্লাসে যাচ্ছে it doesn't have time for other exercise. Scarcity of playground in school and residential areas. So here again population based and individual based approach. Population based you have nationwide policies, you should have rather, it's not being done. For example, restricting marketing of unhealthy foods, nutrition labeling, obesity screening, food taxes and subsidies. Okay, you should increase the tax on all this food which can increase your weight. Then food and vegetable initiatives, physical activity policy, social marketing campaigns. Community level, you can do it at school level, multi-component levels, early child care settings, primary and secondary school. So individual based, you give information about lifestyle diseases and you try to change them. It's not possible always. Make the person aware about the problems of excessive weight gain and information about healthy diet and physical activities. Again, kotota khave, sheta if you adjust the food. Take one helping of this, one helping of that. Encourage children to eat regular meals including breakfast. Encourage intake of low salt foods and limit the intake of energy dense foods. Encourage ration of daily 5 portions of fruit. Okay. And encourage children to have physical activity. তোমার স্কুলে কটা পিরিয়ড ছিল কটা ক্লাস ছিল 7টা কি কি ক্লাস সাবজেক্ট ছিল ক্লাসে ক্লাস 8টা 7টা 8টা কি ছিল ইংলিশ বাংলা তারপর হ্যাঁ ইংলিশ বাংলা সায়েন্স দেন ম্যাথস
Sir, ইংরেজি, বাংলা,
ম্যাথস দেন
ভৌতবিজ্ঞান, জীববিজ্ঞান,
social science and
ভূগোল, ইতিহাস।
ইতিহাস and anything else general knowledge anything else
না স্যার, সরকারি স্কুল।
করছে কিছু আর কিছু ছিল কারোর ক্লাসে ফিজিক্যাল অ্যাক্টিভিটি ফিজিক্যাল
স্যার।
ট্রেনিং হ্যাঁ স্যার তো এতক্ষণ কোথায় ছিলে পিটি ছিল তুমি ভুলে গেলে তুমি ভুলে গেলে এটাই জন্য ওয়েট করছো 7টা বললে পিটি পর স্যার ফুটবল দিত না খেলতো না তাহলে পড়াশোনা করতো বাহ সো সরকারি স্কুলে পিটি হয় না
আমাদের সরকারি স্কুল
স্কুলে পিটি হয় না যাই না
স্যার ছিলেন না তো আমাদের।
স্যার ছিল আমি তো জানি আমার বন্ধু মাস্টারমশাই পড়াচ্ছে encourage family physician to approach to physical exercise discourage sedentary behavior of children particularly screen time আজকাল বাচ্চারা কি করে মোবাইল দেখে মোবাইলে কি দেখছে রিল দেখছে ইউটিউব দেখছে এই দেখছে সেই দেখছে হ্যাঁ খেলা দেখছে মেলা দেখছে but that's why they not able to move encourage physical activity walking 10 minutes a day during the first couple of weeks then add on. Okay, so how do you manage it? Identify the history, take risk factors, give proper dietary advice and psychological assessments. So this is the conclusion. So you need this also is a major issue. Now last week and last Sunday as well as yesterday I was in the Calcutta book fair. I mean I'd gone to the book fair rather. 3-4 people were talking. So they're leveled, I don't know the medical students or what they're students. So one guy is asking, acha bolo to carotid artery diameter koto? So I was wondering carotid artery diameter koto? He's asking the chap. So ota jana jabe. Blood flow to koto? Per second, per minute naki era bollo. So I was wondering who's this guy medical student bolche naki? To bolo amra jodi carotid artery blood flow and carotid artery diameter jodi jante pari, we can identify the risk factors for stroke. So কত প্রেসারের উপরে এটা ফাটবে so I don't know whether then the other fellow saying হ্যাঁ ওটা আমরা চ্যাট জিপিটি তে করব এআই তে করব whatever it is but I'm just seeing the level from the diameter of a carotid artery he's able to predict he's trying to predict stroke হবে কি হবে না okay so here stroke is a major cause of this US and here is the thing stroke is a medical emergency okay now you don't know when a suddenly stroke কখন কি হয় we still don't know and here either the blood supply is blocked or it doesn't go two types of stroke one is blood যাচ্ছে না আরেকটা হচ্ছে blood ফেটে গেছে and the whole place is blocked now stroke is defined as this damage lasting for more than 24 hours okay leading to death with no apparent cause other than vascular one a rapid loss of brain function due to disturbance in the brain supply. Okay. So either it's excess or less. A stroke happens when blood flows to stop of the part of the brain and it's called a brain attack. Like heart attack. Now this is how the blood thing goes. So blood clot can occur during atrial fibrillation here and it goes to the stroke. It goes to the bloodstream. Here's the carotid artery which I was talking about. If you know, as he's saying, if somebody knows the diameter of the carotid artery and the flow and the resistance, maybe they can prevent stroke. That was what they were discussing. Anyway, I didn't go further in the discussion. So, after heart attack and ischemic heart disease and cancer, it's the biggest stroke. Common cause of physical disability. Stroke hoyeche, stroke theke beche ache, but still he's got problems. What is the problem after the stroke? Stroke হয়েছে he's got problems after stroke প্যারালাইসিস হতে পারে আর কি হতে পারে প্যারালাইসিস হতে পারে প্যারালাইসিস বলতে কোমা হতে পারে people are lying in bed for long time many months many days they've been in coma or bedridden etc prevalence about 1.54 per 1000 people now you might be knowing তোমাদের relatives বা কারোর কাছে stroke হয়েছে death rate is 0.6 per 1000 person and it's on the rise okay. Now, these are two examples of stroke. This one is ischemic stroke. Okay. Blood clot stops the flow over here. So this part doesn't get blood. This is called a ischemic stroke. রক্ত যাচ্ছে না And this is hemorrhagic stroke. This is ruptured over here and blood is ruptured. Okay. So the difference between ischemic and hemorrhagic stroke. Normal person cannot identify that. You need a scan for that. You need to get an MRI or scan to identify whether it's a hemorrhagic stroke or a ischemic stroke. So ischemic stroke, area deprived of blood. Hemorrhagic stroke, area of bleeding. So back to that person in the book fair, if he is saying that the diameter of this, the flow over here, he can calculate and give a signal. Okay. So commonest thing is caused by blood clots, we all know that, plaque of cholesterol and all. And commonest is ischemic stroke, reduced blood flow. Then you have hemorrhagic flow is less. Ischemic thing doesn't know. Hemorrhagic, you suddenly find the guy he's very violent. It comes with a big headache, he suddenly collapses, all these things. So it's common by trauma, blood thinning medication, aneurysms, and hypertension. So intracerebral hemorrhage and subarachnoid hemorrhage. You have two hemorrhages, intracranial, intracerebral. When the brain tissue is flooded with this, and subarachnoid is less common, that occurs in the subarachnoid space. What is arachnoid? Arachnoid naam sunicho? What is arachnoid? What is arachnoid? What are the other layers of the meninges? Okay. So bleeding occurs in subarachnoid space, the area between the brain and the thin tissues that cover it. Then there's another thing called TIA, transient ischemic attack. It doesn't last for long, but suddenly that person, he feels that kichu eta hoiche, matha ghurche, hotat kichu eta blackout hoiche, all this stuff. That is called transient ischemic attack. This is similar to stroke, but it should also be regarded as a medical emergency. Here it lasts for less than 24 hours. So a third of the people who have TIAs go for a major stroke, so they should be followed up. And if somebody says, comes to clinic, hotat chokta kalo, laglo, holo, think of transient ischemic attack. Okay. Or somebody says, hotat kilometer laglo, kichu dekhte pachchilo na, ekon ache, ekon thik ache. Don't ignore it. He may have had a transient ischemic attack. So these are the warning signs of stroke. Okay. First is weakness, sudden loss of strength. Trouble speaking. When the person is not able to speak clearly. When there's slurring in the speech, he cannot pronounce words correctly. Third is vision problems. Even if temporary, then headache and dizziness. So these are the 5 warning signals of stroke. Weakness, trouble speaking, vision problems, headache and dizziness. So the common symptoms which we see is weakness, confusion including trouble with speaking and understanding. Now this is very difficult for a neurologist to even assess. The person may not be able to recognize his own family members. He may not be able to speak clearly. If you ask him, Kothai ache, he may not be able to say. He may say something else. Okay. He may say, I'm Bombay ache, but he's in Calcutta or something like that. Then headache, possibly with altered consciousness and vomiting. Numbness of the face, he's got no sensation. Okay. Then trouble with seeing in one or both eyes, and trouble with walking, including dizziness and lack of coordination. Okay. So these are the problems with warning signs of symptoms of stroke. In addition, there can be also bladder and bowel problems, pichap atkate vachina, stool atkate vachina, etc. Then also depression, pain in the hands and foot that get worse, paralysis or weakness of one or both arms, and trouble controlling or expressing emotions. He cannot smile properly. He is not able to smile, etc. Diagnosis will happen fast, and for that you need to remember the acronym FAST. Look at the face. First look at the face. F for face. Does the face look uneven? Second one is, does one arm drift downwards? Third one, speech. Does the speech sound strange? At a normal look sound kata also, but when you're speaking to him again, his speech looks kind of different. If you notice this, then it means The chance of stroke. Fourth one is of course USA, that is time. But you call 911, but instead of 911, you call in India 108. If any of these things are there, face, weakness, slurring of speech, speech problems, then you contact the emergency services. These are the common signs for stroke. Okay. So if you are trying to raise both hands, does one hand go like this, one hand go like this? If he smiles, does one face go to the other side? That's called Bell's palsy. And speech difficulty is a speech slurred or strange. So blood tests, what all blood tests you do? You know various levels are there. You do a CT scan also. You do an MRI scan also. Then you do a carotid ultrasound to find out the blood flow and to see if there is any plaque present. And cerebral angiogram and echocardiogram of the heart to see any clots in the heart, which is the reason for the stroke. So ischemic stroke, you give aspirin and you can do a TPA. Along with that, angioplasty, carotid endarterectomy. Hemorrhagic stroke, you start with give medicines to reduce the blood pressure, overall blood pressure, prevent seizures, and prevent constriction of blood vessels. So if he's taking medicines like, he should be given drugs to counter the medication's effect. Warfarin is an anticoagulant, okay. So that actually increases the chance of bleeding. So you should be given blood to stop the bleeding because it's a hemorrhagic stroke. So warfarin and aspirin are double-edged swords in the sense that they are anticoagulants, but that they increase the chance of bleeding. Surgery can be used to remove any problems with blood vessels. Ajkal prochur high-tech surgery ache. Even arteriovenous malformations can be treated with surgery if they're not too big and not too deep within the brain. Okay. So those are the ones that normally burst. And rehabilitation. Now rehabilitation is very important. If you have a stroke, it's important to rehabilitate the person. You give him you need bed. First you need a physiotherapist. You need to give him a orthopedic, anti-bed sore bed, which is basically a pressure bed, so that he can roll over side by side. Then you might need a home nurse. Then speech therapy to help him develop his speech. Practice relaxation and changing communication style using gestures and different tones. Physical therapy, some physiotherapist has to come and assist in that. You should practice walking a bit if he can, or maybe move his legs and all. Occupational therapy, daily activities after stroke, daily activities like bathing, going to the toilet, etc. affected. You may need somebody to help out there. Cooking, eating, reading and writing. People may find it difficult to hold a glass even. And joining a support group, somebody's group of, like USA and Western countries, they have different groups for people suffering from Alzheimer's, people suffering from stroke, etc. Join that group so that you know that what is there. So it's a useful place to share information also. And support from family and friends to provide practical support and comfort. Prevention is eating a healthy diet, maintaining a healthy weight, exercise regularly, no smoking, avoid alcohol or moderate consumption, and keep blood pressure under control, keep diabetes under control, treat obstructive sleep apnea, and all this can reduce the incidence of strokes to a large extent. Okay. So stroke is a prevalent stroke in India. It was so much in so many places, and we have this figure also status. Okay, so that's all. Thank you.